Hello, Doc. Hello, Doc.
Hello, Doc.
Well, you're welcome back. It is Monday, and we have a doctor here who is a sight for sore eyes. She is a senior medical officer at Wejagbawe Municipal Hospital. Goes by the name of Dr Emefa Dzide. Doc, you welcome.
Thank you.
And how you doing?
Very good.
Your weekend was good.
By God's grace.
You're still reeling from the cold, eh? Yeah, it's still in there. A lot of coughs and
yeah, a lot of those upper respiratory. Yeah.
Okay. Are we doing? What's the name? The one that you don't like. the one that they cover themselves with the heat, whatever. You're not doing that.
No, I'm not doing that. The steaming.
Yeah. You're not doing that. Anyways, you're welcome. Today we're taking a look at burns.
Yeah.
Okay, it's interesting. When we say burns, are there different types?
Yes. There are different types depending on what caused the burn. So we have thermal burns. That's the usual burns.
Yeah.
We have something hot touches your skin and all that. So maybe fire, or maybe an iron, something, a hot metal, or maybe hot liquid like tea, sometimes even steam.
Yeah.
When it's very a lot and it's very forceful. It can also
I got
cause
some
severe
steam
burns.
burn, but it wasn't too severe from my steam iron. I don't know how I placed my hand close to the iron, and then but that wasn't too severe. Yeah.
We can also have radiation burns.
Okay.
The commonest ones from the sun burns that we get. Sometimes too, there could be some from maybe with X-rays, but that's when you are prolonged exposure, not just the X-ray you go and take for a few seconds. That one shouldn't be dangerous. There are chemical burns, so things like acids, alkali, especially those who make soap. They have that soda, and I don't know what they use, but they usually get burns.
Is it
from
bicarbonate or something? I don't know.
I'm not very sure, but they have this alkali that they use for preparing soap. It's also very corrosive when it touches the skin as well. Sometimes there are some detergents and some solvents that are very strong that can also cause burns. And we also have electrical burns.
Okay.
Yeah, so sometimes when you get an electrical shock, they can also actually burn the skin, and that usually gives like full thickness burns at once. So those are actually very dangerous.
Okay.
Yeah, so those are the types of burns that we can have.
So we have you said thermal, radiation, chemical, and electrical.
Yes.
Okay. Let me ask. So the how do you call it? The management of these burns, are they similar? I know we'll go into the detail, but is all burn be burn or no be all burn?
not all burn be burn. So they are not really similar, but once we classify them, we will know how to treat a class of burns. But the types of burns, we have different approaches, but the commonest ones is the thermal burns, which is what we'll talk more about.
Okay. Let me ask this question, because usually when somebody experiencing some form of burn, and I was mentioning that I had some steam burn, but it wasn't too severe. Sometimes you hear maybe some percentage, 80% burn and whatnot. How do you tell how severe a burn is?
Okay.
Yeah.
So we usually use the degrees.
Okay.
First degree, second degree, third degree, and that's depending on how far deep into the skin thickness they have gone. So the first degree is just the superficial layer, the epidermis.
Okay.
Then the second degree burn is when it has entered into the dermis, which is the layer beneath the epidermis, with the soft tissue, the hair follicles, a few blood vessels in there and stuff. And then third degree is when it has completely bypassed through the skin and it has gone under the skin to tissues underneath the skin, so it has touched the muscle, the tendons, and those kind of things.
Okay.
Yeah.
So three main.
Those are the three
difference.
main.
Okay. So first degree, second degree, and third.
So the
degree.
first degree burns, they are usually very superficial. It's just the top is dry and it's painful and all that, but you don't really get the blisters. It's second degree burns that you have the blisters forming.
Okay.
Yeah. Third degree burns may form blisters or may just form ulcers all at once. And with those kind of burns, they might not even feel pain, because the heat has burnt the nerves that are supposed to sense pain. So in third degree burns, if it has affected the nerves, the person might not even feel pain in that area. But second degree burns are actually the most painful ones that people experience.
Is this something that we can see with the naked eye, or it's only at the medical professionals who can tell the degree or the extent of the burn?
You can once you have a blister forming, then you know you've got a second degree burn.
Okay.
Once there's no blister forming and maybe the area is just red and painful, then you know it's a first degree burn. Yeah.
And then the third one there, you don't want to know.
Third degree. You yourself, you'll be afraid that you come.
Now, let's look at first aid, because I know first aid is recommended a lot with burns. And so what kind of first aid, immediate first aid, should be administered? And I don't know if it is different for the various degrees of burns, or it's a generic one that can,
Once the skin is still intact, we do, that's usually first degree, second degree burns. We just pour cool or lukewarm water over the area for about 20 minutes. So if you just pour 1 cup of water over it, you haven't done much. Okay, so the water has to be consistent for quite an amount of time, like 20 minutes. Maybe you can do 10 if maybe you have water shortage or something. But you have to do it for some appreciable amount of time for some relief or some effect of the water. Please never use ice or very chilled water on a bed.
I was going to ask about that, because if cool water will work, then ice should do better.
Ice is too much to the other extreme. Actually, ice itself can burn.
Yeah.
So you are giving another extreme, which will rather worsen the damage to the tissue that has already been affected. So no ice or chilled water, and don't put, I think when I was a child they used to tell me to put margarine on it,
or they use shea butter.
Shea butter is fine, but don't use margarine or those kind of things on.
Petroleum jelly
is fine, not immediately, yes, but it's fine, especially with the first degree burns. Petroleum jelly is very fine.
All right, but not margarine.
Not margarine.
But margarine feels like you are cooking some, you are going to fry something.
Yes, a lot of times when it happens in the kitchen, maybe something hot has spilled on your hand, then they'll tell you, put margarine on top of it. That actually does not help.
I didn't know that anyway. So the cool water for about 20 minutes. Yes,
and then remove, if your hands especially, remove rings or anything that is tight around, because usually the area of the burn swells up. So if the rings are still on your finger, it can cause occlusion, and it may make the ulcer worse and all of that. So you remove rings or anything tight around the area where the burn has occurred, and then you can apply aloe vera, cocoa butter, petroleum jelly, as you were saying, something mild to keep the place cool and avoid it from getting too dry. So basically that's what you do. If it's a chemical burn, if it's a powdered substance, try and then shake off the powder as much as possible. If it's on your clothing, remove the clothing that you are wearing with the chemical on it. If it's a bit wet, you can wash it off, but wash it with copious amounts of water to make sure you get everything off the area of the skin to avoid the contacts.
Are we able to administer first aid with radiation and electrical?
No, not really. There's nothing much you can do at the home that would give you any relief or anything. You have to come to the hospital for that.
All right. And I know one thing that is associated with burns is infection. Are there some signs of infection or complications that we should look out for if we have some form of burn?
So if the burn wound is probably not healing very well, or the pain is becoming, it's increasing in severity instead of decreasing. Then you should go to the hospital and then have it checked. Most often, the first degree burns, you don't really have so much complications because the skin is still intact. But once the skin comes off and the body is open to infections and those things, that's when the complications come in, the scarring and all those other things. But basically, if the skin is intact, you shouldn't expect so many complications.
So now we go to the hospital. Tell me the types of treatments available for burns.
Before we go there, I want to talk about what we should do. What should prompt you to come to the hospital with a burn.
Yes.
So usually if the burn has covered more than 10% of the body surface area, or if it has affected maybe delicate places like the face, around the nose, that area, or the groin area, especially with the children, bathing the children, those things. Yeah, that happens a lot. Yeah, or it's 10% of the body surface area. For a child is different from an adult, because an adult...
I was going to ask 10%. How do you calculate that? So let's say the back of my hand, that would be what?
The 2%? Back of your hand is like 3%.
It's 3%, yes. Okay.
So probably like your forearm area.
Okay.
So if it's maybe covers a lot of your forearm area, then you should come to a hospital. If it's a big area.
Okay.
Basically.
Okay.
But for children, the back of the hand is actually more than 3% because of the body size ratio and all that. Yeah. But once it's a big sizable burn,
for children, I would, no matter the extent, I want to go to the hospital.
Most definitely. That one, no one would be upset with you for doing that.
Okay, so let's go through the treatments.
Yeah. So for the burns, we usually do pain medication and we dress the wounds. We assess, and depending on how severe the wound is, we might give some ointments or some things, maybe zinc oxide cream. But from at home, what you can do, you can just use, as I said, the petroleum jelly and the rest. Or if the skin is peeled off, maybe the blister is peeled off, you can get the non-stick bandages or dressings that they sell at the pharmacy. So you just ask the pharmacist for dressing for burns. So it's like a bandage, but there's some medication in it so that it doesn't stick onto the wound, so that when you want to remove it, it will peel off the skin again. So but don't just take normal bandage in the house or normal plaster. Put on
usually we use
you
and then when we want to remove it,
yes, when you want to remove it, then you are in trouble. So you don't do that. But basically that, and don't put ointment. People have been putting these like those kind of heated ointments on burns. Please, you are rather burning the burn. So please,
you're fanning the fire.
So please don't do that. Don't put toothpaste on it. I've heard about people putting toothpaste on it, and don't clean it with hot. I recently had someone who was cleaning a burn wound with hot water. I didn't understand why. Maybe
warm water, because they're thinking that maybe it could be infected, so they're using the warm water to treat it. I don't know.
Because the person got the burn because of hot water pouring, and then when the blister formed, they were using warm water to clean it, and
especially when they are children and they are telling you that the thing hurts, but you think that no, this is the right remedy for you, if you are doing it to yourself, maybe you feel it and you're like, hey, no, I have to stop. Anyways,
so just do that, and then try and protect the area from the sun's rays. So try and keep that area, the burn area, covered. Don't be walking around with that area exposed. You can take maybe some paracetamol or the over-the-counter pain medications if you are in pain, but know that the pain should not persist for more than a week. So once it's going beyond that, then please come to the hospital. Maybe there's an infection going on. Okay. Now, if someone has a severe burn, tell me how long usually it would take for that to heal. As for that one, it depends. It depends on how deep the burn has gone through the skin and the surface area over the body that is involved, and also the part of the body that has been involved. Some areas heal faster than other areas, but usually it can take months. Actually, depending on the severity. Very severe burns take months, and can even take up to a year before the wounds will actually completely heal. We're running out of time, so I want to ask this question. I don't know if there's anything else that you want to add, then you look at it. If somebody has a burn that is refusing to heal, right? So it's been to the hospital. I'm sure there are stubborn burns like that. It's refusing to heal. What should that person do? Well, they have to come to the hospital, and then we would assess. Sometimes the blood supply to the area may be affected. You see, those things are not very simple. Each individual might have a different reason why theirs are not healing. Some people probably because they have a medical condition, maybe they have diabetes, sometimes they have HIV, and their immune system is not able to pick up, and all those things. Those are all contributing factors.
Okay. Are there any long-term effects of burn, and any way to manage or treat that as well?
Long-term effects, only the scars per se, but with severe burns, they have a lot of other complications, and depending on the size, sometimes we get contractures. So because you want to keep the hand in one position because moving it hurts, but when you don't move it, then the muscles get stiff, and the muscles get fibrous, and they are not flexible anyway, like afterwards, and you can't move freely, and those kind of things. So there are actually a lot of different issues. Sometimes the contractures are so bad you might need surgery to break them in order to be able to have function of the limbs. But those are in severe cases.
You mentioned scar, and I know even for mild burns you could have some scars, and I was told growing up that you could use milk of magnesia too.
Well, I don't know.
You don't know that? Doc.
I know about some treatment for scars, but milk of magnesia, I cannot confirm or deny. I don't know about.
Oh, that's what my grandma told me.
Maybe you went.
Some people actually use even milk, like normal evaporated milk. You know, they smear it on scars. But that one I've not done it. I don't know if it works.
I don't know if it works. But usually, maybe to increase like your protein intake if you are having burns, so that it would improve or speed up the healing process.
Okay, protein.
But yes,
all right.
But
protein too is expensive. we do a lot of carbo. We don't do protein like that. But when you have burns and you take in more protein, you could speed up the healing process.
Yes.
Okay.
But
any lifestyle changes?
Oh no, not really. Not really. Just that should be fine.
Okay. All right. Anything else that you want to add as we wrap up? Quick one.
Just to prevent the burns, let's all be safe in our homes, especially with the children. Don't leave a cup of hot tea on the table where the child can reach. And if you're coming to bath the baby, don't leave the baby alone close to the hot water, those kind of things. It might be simple, but people overlook those things. And
I think we don't pay too much attention to our kids. One time I was in my son's school, and then there was this baby girl, about 2 years, had these burns all over the body because hot water poured on her. You know, I mean, as parents, I think that we should pay more attention to those things.
Yeah, we should just be very careful where we put, especially the hot liquids. That's usually what happens to the children.
The children will be running around the kitchen, and there will be some hot soup on the fire.
Yes.
You need to pay attention to that.
Yeah.
Okay. Thank you very much, Doc, for the insight today on burns. Next week, I'm told we'll be looking at stomach ulcer.
Yes.
Stomach ulcer. Okay. I've got some questions on that. So when we meet next week, we'll talk about that. But thank you very much for coming on the show today. All right.